or coronavirus originated from China and so far has infected more than 100,000 people, close to 105,000 people around the world in 72 countries, and has caused more than 3,200 deaths worldwide. And to date, as we know, the different type of outbreaks that have happened over the years, this is the largest coronavirus outbreak in the world to date. It poses some risks and concerns to the community and us as in general, because it is spreading everywhere in each of the country, in every countries. Even in Canada, it is increasing rapidly. Right now, as of this morning, in Ontario, we have 26 cases in Ontario. None of the cases are in Windsor and Essex, which is a good news. And so I gave some update with respect to how we are working as a public health agency for more than 2 months now in preparation to this point, working with all the acute care partners, doctors, EMS, and the family doctors in the community to early diagnose a case of COVID-19 or coronavirus in the community and to prevent and limit the spread of infection in the community. Some of the key messages that I used is be vigilant, look for the right information, right resources. There's a lot of misinformation that's out there. Come to our website, v2.org/coronavirus. It has all the latest up-to-date information available for us. Some of the recommendations we are saying in public is to prevent and limit the spread of not only just corona or COVID-19 virus, but also for any type of respiratory infection. Influenza is very much prevalent in our community. There are a number of people who are infected with influenza. They all require the same level of protection and the same technique to prevent it. Hand washing is the best thing that you can do if you're coming to any of the crowded places. One of the things that you need to consider if you are sick, and by sick, if you have fever, cough, and you're coughing and sneezing, you shouldn't come to a crowded gathering. And if you do, making sure that you are not coughing and sneezing on other people. Making sure if you have a cough it in your sleeves or in your elbow without infecting or exposing other people. Using an alcohol-based hand sanitizer or warm water and soap, do the appropriate hand washing for, as Brother Sinan pointed out to me, at least 15 to 20 seconds of contact time with soap and water. Make sure that you go into and rub all your corners of the hands, the webs of your finger, the tips of your finger. You are doing that for at least 20 seconds to protect yourself and also to your loved ones. One of the things that I also touched on about the mask piece. So mask is a good for people not to spread the disease. Mask is not a great thing for you to not to contract the disease. Your best defense still is as simple as it sounds, hand washing. Social distancing, if you're sick, avoid crowded place, and continue to take all those precautions. If you're sick, staying home, and contacting the health unit if you have any questions or concerns. So I'll stop here.
Jazakallah khairan. May Allah bless you. On your behalf, would like to thank Dr. Wajid Ahmed for his presentation and for his advices. And as a masjid, we're taking some steps so far for prevention. And as you've seen, there's sanitizers at the entrance. And also we update our cleaning routine or adding disinfecting wipes and spray. So the spray twice a day being done in the carpet and all areas. And they use the cave, which is being recommended in the hospitals. And we use the wipes for all surfaces, railing and desks and all others, which trying our best. And inshallah, we're going to have a meeting now with the doctor and other people are involved to update the policy that might, inshallah, be something be implemented all the time, not only for coronavirus, for prevention. And may Allah subhanahu wa ta'ala protect all of you.
Just one last thing. If you cannot make it to Al Hijra tomorrow night for the Human Concern International fundraising for Idlib, you can drop off your donations to the Treasurer's office. They are taking check and cash, and that will be taken to Al Hijra tomorrow, inshallah, and that will be given to Human Concern International. The money goes directly to the refugees for food, clothing, and medicine, and help our people, inshallah. Allah will question you on the Day of Judgment, inshallah. So help as much as you can. Jazakallah.
If any interested of those specialists or doctors that want to join us in the meeting, they are more than welcome. We're going to meet in the boardroom. Jazakallah khair.